Hello, and thank you so much for your interest in my programs. My name is Katrina Sanders, and it is a true honor to have you looking through my speaker packet. I wanted to take the time to go over with you a few things for you to consider when you're looking through my courses. This little video is going to be a guide walking you through some of the details you may not necessarily see within my speaker packet. With regards to my getting them to ask for treatment, a periodontal case acceptance program, this is your true guide to all things patient communication strategies and optimizing and improving periodontal case acceptance. This is a fan favorite for any meeting planner who has a lot of participants saying, we need help when it comes to communication. We need help when it comes to improving case acceptance for our patients, particularly when it comes to periodontics. This is also a fan favorite for any meeting planner who wants to be able to take a critical conversation like discussing periodontitis and start to uncoil or unravel the clinical side of communicating this to our patients. Now, this is a fan favorite for doctors and hygienists, but we do find that oftentimes, our administrative team members like to get involved in this kind of coursework. This is a really terrific course that we do also find pairs well with a wine tasting. So in the event that you had an interest in integrating wine of some kind into your program, this is absolutely a fan favorite course. How do we integrate the wine? Fabulous question. Typically, this is done by doing a wine flight. So a series of 4 or 5 different wine tastings throughout the program. And every so often throughout the program, I will be delivering content and then take a short pause so that we can go ahead and pour the next wine and experience the wine. But that's not all. As a sommelier, I actually deliver the important modalities about how sommeliers taste wine in the early portion of the program. So not only do your participants get information about periodontal case acceptance, but also how to actually taste wine like a sommelier. Now, the wine certainly is not required, but for meeting planners who want to add that extra sparkle to their meeting, this is a terrific option. Again, anytime that you've got attendees who are saying we need help with more communication strategies, this is a terrific course. And this is a course that can be done as a partial day lecture. It can also be done as a full day morning lecture and then afternoon workshop series, where we're actually now getting down to the nitty-gritties of rehearsing some of these communication strategies. As you can see, if we were to go about doing the full day lecture and then workshop series in the afternoon, an all-team approach is terrific because now we can get we can get our administrative team all involved in where we move within that patient communication process. So, getting them to ask for treatment can be done as a partial day lecture. It can also be done as a partial day wine tasting. I do encourage you to consider putting that in an afternoon slot, not an early bird morning slot, if you intend on doing a wine tasting piece. Or this could be considered a full day morning lecture, afternoon workshop, where we're going to rehearse those communication strategies together. With that, I want to thank you so much for considering me, Katrina Sanders, for your meeting. Although this short video walked through just a tiny little blip of a course you might be considering, please do know that my team is always readily available to answer any other specific questions that you may have. It is truly a pleasure and an honor to be considered, and I hope you'll reach out if we can answer any other questions for you. Thank you so much, and I hope you have a beautiful day. Thank you.